Venous congestion in ischemic bowel. Definition: overfilling and distension of the veins with blood as a result of mechanical obstruction or right ventricular failure.
Our body depends on the heart pumping to deliver oxygen and nutrient to the body cells. When the cells are nourished properly, the body can function normally. But in certain circumstances, the body tissues can be filled with fluid instead of oxygen and nutrient. This abnormal accumulation of fluid happens due to congestion. One systemic congestion may occur as a consequence of decreased cardiac output. Congestive heart failure is a progressive condition in which the heart muscle is unable to pump enough blood through to meet the body's needs for blood and oxygen. It refers to the stage in which fluid builds up around the heart and causes it to pump inefficiently. Congestive heart failure develops when ventricles cannot pump blood in sufficient volume to the body. Eventually, blood and other fluids back up inside lungs, causing shortness of breath. This is called pulmonary edema. Congestive heart failure also affects the kidney's ability to dispose of sodium and water. This retained water also increases swelling in the body's tissues.
Application in medicine. Mesenteric ischemia can be caused by acute arterial or venous thromboembolism or by decreased blood flow to the splenic vessels, usually owing to hypotension in patients with atherosclerotic disease.
Small bowel refers to the small intestine. An infarction is when ischemia, which is an inadequate blood supply, causes necrosis or tissue death. So a small bowel infarction happens when there's a reduced blood supply to the small intestine, and this causes parts of the intestinal wall to necrose or die, which can be life-threatening. Now, the small intestine is made of several layers. The innermost layer is the mucosal layer, and it's composed of a few of its own layers. The first layer is the epithelial lining, and it faces the lumen. Next is the lamina propria, which is rich with blood and lymph vessels. And finally, there's the muscularis mucosae, which has smooth muscle. Deep to this mucosal layer is the submucosal layer, which has connective tissue with proteins like collagen and elastin, as well as glands and additional blood vessels. The submucosal layer also has the Meissner plexus, which is part of the enteric nervous system. Below the submucosal layer is the muscularis propria, which is basically two layers of smooth muscle with the myenteric plexus, another part of the enteric nervous system, sandwiched between them. These muscles are particularly important in helping to move food through the bowel. Finally, there's the serosal layer, which is the outermost layer of the small intestines that faces the abdominal cavity. The superior mesenteric artery is the main supplier of blood to the small intestine. Branches of the artery spread through the mesentery, called mesenteric arteries, and penetrate the serosal layer and travel to the submucosa where they branch further into arterioles. Because the small intestine has a high demand for oxygen and nutrients to sustain digestion, it's highly susceptible to tissue injury from ischemia.
Pros and cons. Pros. Some experience with percutaneous endovascular intervention has been accumulated, and hemodynamic instability can also be an indication for surgery.
Bowel infarction results from restricted blood supply to the bowel, most often due to bowel obstruction or occlusion of one of the mesenteric arteries. Bowel obstruction is most often caused by intestinal adhesions, which frequently form after abdominal surgeries, or by chronic infections such as diverticulitis, hepatitis, and inflammatory bowel disease. The condition is difficult to diagnose properly, as the symptoms may resemble those of other bowel disorders. Bowel infarction. Note the gray discoloration. Patients who have undergone extensive resection of the small bowel may develop malabsorption, indicating the need for dietary supplements. Volvulus is a rare but life-threatening cause of bowel infarction which requires immediate medical attention. Central abdominal pain which is resistant to narcotic analgesia may be an indication of bowel infarction.
Cons. Aside from timely diagnosis and treatment of predisposing conditions, there are no preventive measures for AMI. Treatment options depend on the etiology of intestinal ischemia.
This video shows ischemic and injured bowel evaluation with pinpoint fluorescence imaging. Case 1. In emergency situations like mesenteric ischemia, circulation might be compromised and perfusion of the smaller mesenteric vessels unclear. This is a case of a 38-year-old woman with embolic events during sepsis. She developed a severe small bowel ischemia, and visually all the small bowel was damaged. By using pinpoint, however, several intestinal areas which looked macroscopically ischemic were proven to have reduced blood flow, which was estimated now as recoverable. In this case, there was always a clear contrast between fluorescence and unperfused areas, as you can see. Marginally perfused areas could therefore be preserved. By use of the ICG for fluorescence, an additional 40 centimeters of bowel could be preserved compared to the macroscopic findings by visual inspection alone. Several second look laparotomies were subsequently performed, but no further bowel resection was needed.
Issue applied in Ecuador. Nowadays, in Ecuador, there is a low percentage about this disease, so there is no information about we can reduce the future cases. We can only take care the other countries' information.
Hi everyone, I wanted to bring you a quick video on the high yields for acute mesenteric ischemia so you don't miss it on the wards. Let's get right into the student that you may be at times. The physical exam seems pretty straightforward, and maybe there are some abnormalities, but it's not crazy bad. But you see this patient and they are just in pain. And so this is the first tip off here that you might be dealing with acute mesenteric ischemia. So severe abdominal pain that's not in proportion with your findings on physical exam. So here we have our patient swearing, screaming, all that jazz. The other thing that you're going to see with this patient is that they're going to be vomiting, and then in addition to vomit, they'll also have diarrhea. So that's kind of easy to remember. So we see vomit and then we have diarrhea. So vomit, diarrhea. And then the next symptom that, or clinical finding that you're going to notice with these patients is that they're going to have a history of some kind of heart disease, particularly AFib. So let's draw that in here. There's our heart, and that's to remind us that these patients may have a history of AFib. And so why do they have acute mesenteric ischemia? Typically, the acute form comes on because of an embolism of some kind, and the embolism is typically occluding the superior mesenteric artery. And so that's why they get this sudden onset of pain and discomfort. So now that you have this clinical picture in mind, you're no longer that confused med student. Instead, you are the med student who knows what the diagnosis is, and you're going to make this patient feel a lot better.
In conclusion, it is important for medical community to prevent this kind of disease that can become deadly if we don't act in time. So in the future, maybe a lot of vaccines at the drugstores that people can buy to reduce some symptoms or even the disease.